Psychosis is a mental disorder in which the patient cannot distinguish reality from imagination, and the umbrella diagnosis is schizophrenia. So patients usually experience hallucinations. This can be auditory or visual or tactile hallucinations, as well as delusional ideations. And delusions means irrational fixed beliefs. For example, they think that I am the president of the United States, or the aliens are going to come and kill me. So they have a delusional, irrational belief, and they believe in it like it is a fact. So this is what is meant by delusions. So patients usually experience positive and negative symptoms, and the positive symptoms are the things that shouldn't be there, but they are there for them. In other words, the positive symptoms for the schizophrenia patients are the hallucinations and the delusions. And these are mainly caused by the increase of the dopamine levels in the mesolimbic system. So this is what mainly derives the positive symptoms. The negative symptoms, on the other hand, means that the normal functions are reduced or lost. So what is the normal social function? The negative symptoms would be the opposite of the normal social functions of a normal human being. So in other words, the patients would include symptoms such as having a flat effect. And a flat effect means he has an emotional blunting or no facial expressions. He cannot express his feelings in happy facial expressions or sad or excited. He cannot experience the normal facial expressions, and this is known as the flat effect. Also, he experiences something known as alogia, and alogia means poverty of speech. He doesn't speak much, and he cannot find the right words to describe things. So this is alogia. And he also experiences anhedonia, and we've heard the term anhedonia from the last lecture, and we said that this is also a common symptom of depression. And anhedonia, we said that it is the inability to feel pleasure in any forms. Also, the social withdrawal or the isolation behavior is one of the negative symptoms. And the negative symptoms, they are actually derived by the increased serotonin and also the decreased dopamine levels. But where exactly in a specific region in the brain known as the mesocortical area. So these names are important to distinguish. So the positive symptoms, which are the hallucinations, which can be auditory or visual hallucinations, are caused mainly by the increased dopamine in the mesolimbic system, whereas the negative symptoms are caused by the increased serotonin and decreased dopamine in the mesocortical area, specifically of the brain.